In an exceedingly rare case that has shocked the medical community and alarmed public health officials, an 11-year-old Canadian boy tragically succumbed to rabies after being awoken by a bat resting on his nose and mouth while visiting a cottage in Ontario. This incident took place in 2024, as reported in the Canadian Medical Association journal published this week. The child's father was quick to respond, dispatching the bat outside where it had been found. However, he did not seek medical attention due to initial lack of visible injuries or erratic behavior displayed by the bat. 19 days later, the boy began experiencing numbness and swelling on his face. His family took him for emergency care, first diagnosing herpes viruses before moving to a presumed diagnosis of herpes gingivostomatitis. Days later, he developed severe symptoms including difficulty swallowing, confusion, and visual hallucinations. The child was intubated and admitted to the pediatric intensive care unit where doctors strongly suspected rabies. A test confirmed the diagnosis, with a bat rabies virus variant identified by the Canadian Food Inspection Agency. This case marks an alarmingly rare occurrence in Canada, highlighting the critical need for better public awareness about how to recognize and prevent rabies transmission. Doctors at the University of Manitoba emphasized that any direct human contact with a bat is now considered a clear indication for post-exposure prophylaxis, medical treatment immediately after potential exposure to a rabid animal. While infection can be fatal once symptoms develop, this case underscores the importance of prompt action in such scenarios. The boy died 17 days after being admitted to hospital, marking an exceptionally tragic end to what should have been a routine family vacation. Rabies infections are rare in Canada, with 28 human deaths due to rabies recorded since 1924 according to the Canadian Veterinary Medical Association. However, this low rate of rabies is due to widespread, ongoing vaccination programs. Failure to continue these programs can and will result in a return of disease, as stated on their website. Any direct human contact with a bat is now considered a clear indication for post-exposure prophylaxis, medical treatment given immediately after potential exposure to a rabid animal. Infection is almost always fatal once symptoms develop, underscoring the importance of early intervention and awareness in preventing such tragedies. This case serves as a stark reminder of the severity and urgency of rabies prevention measures, emphasizing the need for better public education and healthcare protocols.